also understand that there's different types of seizures that somebody may actually experience, and we actually have a graphic that lists the different types of seizures. We can see them actually listed here. So doctor, perhaps if you could kind of walk us through that list and explain the difference between these types of seizures.
Sure. From the focal, now we talk about the characteristics.
Okay.
So we have the simple focal means that you have a single manifestation at the beginning of the seizure. It can be a motor manifestation, it can be an abnormal sensation. Motor, for example, just twitching of the arm, twitching of the leg.
Right.
It could be sensory, something that you feel is like every time that I have this seizure, I feel that half of my body is going numb. It's something like that.
Okay.
Complex.
We do, I'm sorry, doctor, we do have that graphic up there now to kind of explain the different ones.
So the complex focal is when you have impairment of consciousness, meaning that you are not completely aware. You can still sometimes communicate.
Okay.
You may or may not have memory, but there is consciousness impairment. And when we go to generalized onset, that means that it is present somewhere in the brain but goes everywhere and it can have different manifestations. An absence seizure, which it's very important because there is a confusion. People sometimes think that they're having an absence seizure because they are just basically spacing out or staring, but sometimes that could be a partial complex seizure. So the definition of an absence seizure is to a certain degree electrographically, in which we see a generalized activity in the electroencephalogram. A tonic is just loss of tone, in which the patients have these bad falls and sometimes with bad injuries.
Okay.
Generalized tonic clonic is probably what everybody associates with a seizure, which is the generalized body shaking.
Okay.
And myoclonic is a variation, is basically myoclonus of the muscle. It's similar to the generalized tonic clonic, but it's more like myoclonic, which is more rhythmic movements. It's a little bit different.